Governor J.B. Pritzker may soon make the rare move of vetoing a bill that passed both houses of the Democratic-controlled General Assembly unanimously. The bill has to do with how private ambulance companies are reimbursed when they transport Medicaid patients. Amanda Vinicky joins us with more on this. Amanda.
Yeah, Brandis, before we get to the actual heart of the matter, a quick lesson in how the ambulance system works.
A lot of people don't really know about it until they need it. Everybody just thinks that you call 911 and the ambulance shows up, and then, something happens and you get to the hospital.
So by and large, 911 calls are answered by EMTs who work for the local fire department, and they take people to the hospital. But the majority of ambulances out there are actually run by private companies, and they do other transports, say from one hospital to another, or maybe from a hospital to an emergency room. Medical necessities, but not the same 911 style emergencies. And these are the transports that are the focus of the legislation we'll be talking about. Paramedic Demel Fountain says his company, Superior Ambulance, which operates in the Chicago area, was really busy during the pandemic.
We were on the front lines transporting the people who had COVID, transporting from hospital to hospital, moving people to ICUs. So we did do, in the height of the pandemic, we were transporting a lot of COVID positive patients. So risk level was high.
Fountain himself was hospitalized with COVID. He's been with Superior for 19 years now and is actually the operations supervisor for a region that stretches from south part of the city to Kankakee. He says there's a problem now, though. Coworkers are leaving for less stressful and less dangerous jobs that pay the same amount of money as being a paramedic.
And I've had people leave to go work for Walmart. We've had people leave to go work for Amazon. We had one person actually leave to go be a manager for Chick-fil-A.
Now, there are various reasons behind this staffing shortage, which is not singular to Illinois, by the way, but among them, private ambulance companies here say they are not getting reimbursed on time or in cases at all for the non-emergency trips they give to Medicaid recipients. Right now, they file a claim for reimbursement. You can think of it kind of like filing an insurance claim to something called a managed care organization. These MCOs are contracted by the state of Illinois to coordinate care for Medicaid patients and also with the medical providers that give service to these patients, like ambulance rides. Now, the president of the State Ambulance Association says the 5 largest private ambulance companies were surveyed by his group earlier this month, and they reported doing 80,000 transports of MCO Medicaid patients in 2020. He says as of early August, 15,000 of those trips had not been reimbursed.
While the dollar amounts may be small in the world of the MCOs, where they're paid billions and billions of dollars a year, that $2.5–3 million is essential and critical to making sure that there are ambulance services that are available. 15,000 transports that haven't been paid. That is just a staggering number of unpaid trips.
Now, this bill is their solution. The companies want to be able to avoid dealing with MCOs to get those reimbursements and instead go straight to the State Department of Healthcare and Family Services and be paid for by what's known as a fee-for-service model. Now, Samantha Oldfry leads the state association that represents those managed care organizations and says her numbers don't ally with those 80,000, 15,000. She says, however, MCOs have and will work with ambulance companies and any other provider experiencing issues. HFS, by the way, also saying that some claims haven't been paid because ambulance companies either didn't prove that the rides were medically necessary, or also they say one company just today submitted 3,000 claims, some of which were 2 years old. Now, regardless, Frey, again with that MCO organization, says that if this measure becomes law, the ambulances plan could backfire. She says MCOs deny claims at the lesser rate of about 10 to 15%.
When we look at HFS's denial rate for these same services, non-emergency ambulances, their denial rate's 40%, 40. So significantly higher than what the Medicaid health plans are seeing. So we worry that this bill, House Bill 684, is actually going to exacerbate the challenge that the ambulance industry is saying they're trying to solve.
She also alleges that this change could harm vulnerable Medicaid patients. She says the companies now are contractually bound to provide these trips via their contract with MCOs. And without that, she says, private companies could put these trips on the back burner.
What we're worried about is that this bill is going to put a barrier between our most vulnerable members getting to doctor's appointments, getting to scheduled treatments like dialysis or to non-urgent surgeries. And so that's why we're so opposed, is the impact on the over 2 million Medicaid members that we serve. And again, it's going to be our most vulnerable people at risk.
Governor J.B. Pritzker's office is taking a similar stance, issuing a statement that says the administration is concerned this legislation has the potential to disrupt care and reduce the quality of provided services to some of the most vulnerable Illinoisans. I did, by the way, also speak with the director of HFS, who had similar concerns, saying that this would jeopardize care and be confusing for Medicaid patients as they try to get these rides. But the head of the Ambulance Association says medically vulnerable people are harmed by the status quo.
They're talking about patients being endangered. What we're talking about here is what really endangers patients: not being able to get the ambulance services that you need when you need them. So talking about those dialysis patients, if we're not being paid by the managed care, we don't have the ambulances that are able to provide the services to pick that patient up from dialysis, to take that patient to a radiation appointment. And, in the very scariest and real of senses, taking the patient that's having a medical emergency to a hospital.
Now, while the governor has not explicitly said that he is going to reject the measure, it sure does look like a veto is coming. And again, that is a rarity, I believe. However, again, this passed unanimously, and I do believe that the General Assembly has only overridden a Pritzker veto once. With that, back to you.
Amanda, thank you.